In the 5 years the DePuy ASR total hip implant system was on the market, the FDA received more than 500 complaints from patients who had received the prosthetic system in their surgeries. Experts now believe that the problem with the ASR total hip implant system rests in the acetabular cup component of the device. In a normal hip, the ball-shaped top of the femoral bone in the leg fits smoothly into a cup-shaped depression in the pelvis called the acetabulum. In a healthy, normally functioning hip, the femoral head rotates smoothly within the acetabular cup and allows free and easy motion in the hip joint in all directions. In a standard hip replacement surgery, the acetabular cup and the femoral head may be replaced. Orthopedic surgeons remove the femoral head and the acetabular cup. These components of the normal hip are replaced with metallic components manufactured by DePuy. A prosthetic metal ball for the femoral head and a metal cup for the acetabulum are substituted for the normal, healthy bone that was there originally. In the case of the DePuy ASR total implant system, reports from consumers now tell us that normal, healthy, pain-free motion in all directions is not occurring. Based on studies of patients who have undergone revision or removal of their ASR total hip implant system, it now appears that the ASR design creates dangerously high levels of friction between the metallic components, the femoral head, and the metallic acetabular cup. The evidence of excessive friction in the ASR DePuy acetabular cup and head is the release of cobalt and chrome ions from the metallic components. While the precise impact of excessive release of chrome and cobalt ions on the body's other organs and tissues is not presently known, what is known is that the ions in many patients have formed cysts on otherwise healthy bone and inhibited bone growth into the ASR acetabular cup. For the ASR total hip implant system to work correctly, bone ingrowth is critically important. Because the ASR has no means of external fixation, no screws, no flanges, no bone cement, it depends on bone ingrowth to properly seat and remain in place. A lack of bone ingrowth means that the cup loosens easily. When problems with a DePuy ASR cup cause loosening, it must be replaced in a procedure known as a revision surgery.